Welcome to Backus Health Beat, your source for health news and information. I'm Keith Fontaine, the hospital's Chief Administrative Officer, and joining me is our guest today, Dr. Amar Ambari, an orthopedic surgeon and a sports medicine specialist, and Dr. Jim O'Day, who is the Vice President for Clinical Service Line Development here at Backus, and also heads up our trauma program as part of that. Thank you very much for joining me. So, millions of people saw live as they were watching the game, and millions more on social media sites, that horrific accident Sunday as Kevin Ware just had that awkward stance and then tried to block a shot, and this horrific accident happened. Could you, doctor, tell me a little bit about what happened there? What kind of an injury are we looking at?
It's an axial load to the leg. He jumped, and when he landed, his angle of his leg was a little bit awkward, so it created an axial load that went up the leg, and it broke his leg right in the area where it typically breaks, in the tibia, which is his shin bone. The problem that was even worse than that is that it was an open fracture, meaning the bone was actually sticking out of the skin, which made it obviously more of an emergency.
Absolutely. When you say axial load, could you explain a little bit?
Axial load, basically, when you're jumping up and down, the ground force pushing up against you as you're landing down is the load that came up. When you're landing straight up and down is not as much as when you're landing a little bit of an angle. And the angle that he landed on was a little bit of an awkward angle. And typically you would not expect it to make a fracture of this magnitude, but of course, in his luck it happened that way. But the load from the ground up is what bent his knee to the position where he ended up breaking it.
Wow. Dr. Day, when you were looking at this, what went through your mind?
Well, a couple things. I'm a sports fan, so I was watching the game, but quickly, it's interesting, when I saw the injury and I watched the way that everyone responded, it made me think of our trauma program. I was so impressed by the way that they stabilized this young man as quickly as they did. They brought the team physician and the rehabilitation specialist. The EMS personnel was available immediately, and we talk about the idea there was a 7-minute or a 9-minute break in the action, but in 9 minutes, they had stabilized a very significant orthopedic injury and had that patient stabilized in an ambulance and on his way to a trauma program in Indianapolis in less than 10 minutes.
Pretty impressive.
It was very, very impressive.
So when we think about this, how well prepared are we in our community?
Well, one of the things that we're, of course, very proud of is that we're the only trauma program in Eastern Connecticut. And maintaining a trauma program in Eastern Connecticut brings a collection of resources, skillful surgeons and trauma surgeons and the rest of the team that needs to be available in a moment's notice to respond to these kind of events that can happen in our community.
Good point, Dr. O'Day. Dr. Ambari, we usually think of ATV accidents or automobile accidents, and that's generally what we see in our trauma center.
Absolutely.
But here we're looking at sports trauma, and I know you've had long experience with sports medicine. What sort of trauma have you seen in the realm of sports?
An injury like this may be on the extreme of the traumas we see. We see a lot of ankle fractures that happen, a lot in injuries like in basketball and soccer. And football, of course, you see every injury under the sun, of course, it's more a traumatic injury. But a lot of players, especially with the pressure from the world around them, they tend to overuse and tend to overtrain, and as a result of that, sometimes they develop these asymptomatic stress fractures. A stress fracture is just like a little crack in the bone, just like when you take a pretzel, put a little crack in it. It's kind of the same idea. That can put somebody more at predisposition to have a more serious injury. So sometimes an injury like this, or some injuries that I've seen, can happen from accumulation of trauma.
So I'm interested in thinking about a patient, like Kevin Ware, somebody with his injuries. If a person like that had come into our emergency department, what would be going on? What sort of treatment would they be receiving? Dr. O'Day?
That's a great question. We have a very well orchestrated response to a code red like this. We work very closely with the local emergency services personnel, the primary responders, both police and ambulance personnel in the community, and they would alert us out in the community that they have a significant injury that's coming our way. We would activate our code red process, which is a way for us to disseminate an alert to all the involved practitioners very quickly. We have trauma surgeons available within 15 minutes of response time, very often faster than that because they stay on campus to be prepared for a code red. There's also a collection of a number of other resources in terms of rehab staff, respiratory staff, and of course all the emergency department personnel who are available, who would be present in the emergency department waiting to receive that patient so that we could put together a well-organized, orchestrated response. And then of course, as the trauma surgeon determines, there are other specialties that would be available, including orthopedic surgery, that could be available very quickly to help us stabilize and care for a patient like that.
Thanks, Jim. So Dr. Ambari, from the surgeon's perspective, what's going on?
Well, an open fracture is a surgical emergency. When the bone is sticking out of the skin, obviously it can put it at a chance of developing an infection. So typically speaking, when somebody like this comes through the door, an OR is ready usually typically right away, and the patient is brought upstairs within 45 minutes to an hour where the leg is cleaned up, the fracture is reduced, and in the case of Kevin Ware, he had a rod placed down, which is a typical treatment that we'd have at Backus Hospital for a patient like that. A metal rod is usually about half an inch wide, goes right down the canal, which is usually an open canal in the leg, and we put screws at the top and screws in the bottom that holds the fracture in place.
We saw some great footage today of Kevin Ware kind of walking out of the hospital. What's his recovery like? What's rehab like for an injury of this sort?
Somebody young like him usually bounces back extremely quickly. His pain level will probably be gone in about a week or 10 days. He'll be probably partial weight bearing. I'm not sure exactly the mechanism, the exact configuration of the fracture, but usually it's partial weight bearing for about 6 weeks, and then they just walk on it normal. He has a great chance of returning to sports by next year and win another championship, hopefully.
That's terrific.
Yeah.
That's terrific. Thank you very much for joining us today. This has been a good talk. I know we wish Kevin Ware and his teammates well.